What are the management options for fibroids?
Well, I think the first thing to consider is, so you found a fibroid on a scan, do you need to do anything about it? Sometimes they're incidental findings, and if the woman does not have any symptoms, then often we wouldn't treat them. If they are symptomatic, and then obviously that's the point when they require treatment. We think about the size of fibroids and the location of the fibroids, how many fibroids you also have. So from a primary care setting, I guess I'd ask you is, how would you normally treat them here?
So when patients do present with us and we get the diagnosis, we offer them a variety of options depending on their symptoms. So if they've got heavy periods, we make sure our treatment is geared up towards that. If it's actually pain or discomfort that they're feeling, then we make sure that we give them pain relief that's appropriate for them and that helps them live a better quality of life. If these options don't work out and we've tried all of our options, then we do refer to our specialists in the hospital. What would you do in the hospital?
What we would think about doing is shrinking the fibroids. By making the fibroids smaller, we can alleviate the symptoms. So there's different ways that we would do that. Sometimes you can take a hormonal injection that will help shrink the fibroids. There's also medications now that are available, oral tablets that can also help shrink the fibroids. We need to take into consideration though whether this woman will want to preserve her fertility, is she still looking to get pregnant or not, and how old she is, as well as the number and size of fibroids as well. There are other treatments that are available, such as trying to block off the blood supply to the fibroids in order to allow them to shrink before that uterine artery embolization. Sometimes we also look at doing surgery to remove the fibroid, and for some women where their symptoms are really severe, a hysterectomy where we remove the womb may be something that needs to be considered, but it would really depend on that woman's circumstances and medical history.
If you've got symptoms that you feel are related to a fibroid, make sure you reach out to your clinician. At the Brooke Surgery, we will thoroughly assess you, get to the bottom of your symptoms and offer the right treatment that is appropriate for you.